Women in Far North Queensland are being denied the chance to choose how they give birth. It follows the controversial decision by Cairns Private Hospital to shut its birthing suites. As Jonathan Lee explains, private obstetricians are frustrated, having been locked out of the public hospital as well.
Shaquille Chong is so angry about the closure of Cairns Private Hospital's birthing suites, she's petitioned the state government. She wants officials to change the rules to allow the private hospital's now jobless obstetricians to be able to deliver the babies of private mums at the public hospital across the road.
Once you lose services in the region and rural areas, it's quite hard to bring them back.
Cairns might be miles from a capital city, but what's happened at the private hospital is being held up as a warning of what's coming to the rest of Australia.
I think the major cities will be the last bastions of private obstetrics. What you're beginning to see is the beginning of things starting to crumble, and so of course regional areas is where you see it first.
Is it sensationalist to say within a decade we might not see private obstetrics offered in regional Queensland?
I'm afraid I don't think that's sensationalist. I actually think that may be undercalling it.
Dr Gino Pecoraro heads a body that represents obstetricians and gynecologists. He's aware of staff shortages, the chase of private profits, and the dwindling number of women who can afford obstetrics cover in their private health insurance. He describes the crumbling of private maternity cover and pressure on the public hospitals as
verging on criminal. I really don't understand why our women and their families aren't marching in the streets.
That's because Australia relies on a public-private partnership. But when private birthing suites close, it leads to specialists leaving town, closing up their private clinics.
If those services aren't provided privately, those patients will go onto a wait list through the public system.
Already stretched, this email exposes the critical vacancies as Queensland Health hunts for casual obstetricians to help deliver babies at Bundaberg, Cairns and Rockhampton hospitals. Wages are negotiable.
Are we in crisis?
I think we're past that. We're seeing that a lot of units are on bypass already. We know that many more are either one resignation or one sick leave away of going on bypass.
Bypass happens when a public hospital is taken offline because it doesn't have enough staff. In central Queensland, Gladstone Public Hospital's maternity unit took a whole year to come back online. Queensland Health says Chinchilla, Billawheeler and Cooktown are all on so-called reduced services, but won't provide the data of how many hospitals have gone on bypass in the last 3 years. There are issues too in New South Wales.
Dubbo, Tamworth, Armidale are staffed by locum obstetricians, which long term is not sustainable.
Dr Anusha Lazzari was trained in the UK.
One of the first things that I noticed when I started working in Australia was how well resourced it was compared to the NHS. And I thought, those bad things in the NHS are never going to happen here because we have such a robust private sector.
Make no mistakes, Ramsay Healthcare, which operates Cairns Private Hospital, is a giant in the field. Despite repeated requests, Sky News was told that there was no one within the company who could answer questions about why the birthing suites here were closed, not temporarily, but for good. It claims it struggled to attract specialist staff. But as one argument goes, there's more money to be made replacing things like knees and hips than delivering babies.
Certainly if they fill their wards with elective surgery, they can make an easier amount of money from it.
But removing private hospital birthing suites takes choice away from women.
This is a situation that is playing out, unfortunately, all over the country. St John of God Indigo has recently announced that their hospital is under review. Mater Hospital Redlands, that's another unit at threat at the moment.
Northwest Private Hospital in Brisbane is another spoken about.
Why is this happening? This is really the root of the question.
If you're a woman and you want to have access to reproductive health care in your private health insurance, you have to pay double what a man does. If you're a smoker, if you play dangerous sports, you don't have to pay a higher rate of insurance. All that goes by the wayside if you're a woman and you want to have healthcare covering reproductive healthcare. That's not fair.
Jonathan Lee, Sky News.